All right, on this lecture, we're going to be doing part 3 of chapter 13, which is the anatomy of the nervous system. We've already talked about the central nervous system. We talked about the meninges of the nervous system, and we've talked about the ventricle system, the cerebral spinous fluid of the central nervous system. So remember, when neurons leave the spinal cord, they are no longer part of the central nervous system. They are now part of the peripheral nervous system, and that's what we're going to pick up here. Just a reminder that we have some of the same concepts in the peripheral and central nervous system, but we give them a bit different vocabulary because they have different functions and different shapes. So a group of neuronal cell bodies in the central nervous system is called a nucleus, and in the peripheral nervous system, we call it a ganglion. A bundle of axons in the central nervous system, we call that a tract. In the peripheral nervous system, we call it a nerve. So to look at a nerve a little bit more closely, we have an image here with the spinal nerve where it has the different layers of connective tissue. So if you remember back in muscle, we had the epimysium, perimysium, and the endomysium, meaning the 3 connective tissue layers that wrapped around the muscle fiber and the fascicles to make the muscle organ. We have a similar system here in the nervous system. We have the epineuron, the perineuron, which is around the fascicles of a nerve, and we have the endoneuron, which is around the individual neurons. So if we blow this up, blow this image of the left up to the image on the right, we have the perineuron around many different axons, but this is one axon that we're seeing here in that image. So you can see that we have the axon is just the one piece of the neuron. So if you remember, we have the neuron cell body, then we have the axon hillock, and then we have the axon that goes down to the synapse. So what we're seeing here in this image here is if I just a little piece right there, if I cut that axon right there and turned it on its side, that's what we're seeing. And then we're seeing hundreds or thousands of those axons all together in one nerve. So remember, a neuron is a single cell. A nerve is a collection of axons. Sometimes people get those mixed up, so just be aware that they are not interchangeable terms. The first set of peripheral nerves that we're going to learn is the cranial nerves. And I will tell you, anybody who is in physical therapy, occupational therapy, nursing, athletic training, you need to know these cranial nerves by name and number and function. So for AMP1, if I give you the number, you need to be able to give me the name and its function. Or if I give you the name, you need to be able to tell me what number it is and what function it is. Or if I gave you a function, you should be able to tell me all the cranial nerves by name and number that have that function, whether they're sensory, motor, or both. Okay, so those are the terms we're going to use, sensory, motor, or both for function. That's all the function you need to know for AMP1. You'll get much more in depth with your clinical classes, but for our purposes, this gives you the baseline if you can just do a sensory, motor, or both. All right, so we have some mnemonics, and I will tell you that one of the best ways to learn the cranial nerves is make your own mnemonic or look up something on the internet that tickles your fancy. There are some really inappropriate ones that a lot of students have used in the past. As a professor, I'm not going to give you any of those inappropriate ones, but they are out there, and some people have had some fun just Googling cranial mnemonics dirty and looking up things. I will warn you that they can be offensive. That's why I'm not sharing them with you, but they have been helpful to some students. That's why I'm telling you about them. So if we did 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. So we have our 12 cranial nerves. And for those of you that don't know Roman numerals, I equals a 1, a V equals a 5, and an X equals a 10. If you have the lower number in front of the higher number, so if you have I, X, that equals a 9, because that's 1 minus 10. If you have it after X, I, that's 11. All right. If you need any more help with Roman numerals, you have to go back to an elementary math class and look it up. That's just the basics there. All right, so the first mnemonic is to help you remember their names. It's on old Olympus, towering, a Finn and German, viewed some hops. Oh, I missed. Towering, top, a Finn and German, viewed some hops. All right, so not the easiest mnemonic. That's why I say a lot of times doing your own, but there's one for you. So olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial. This one. Why is that A? Because this is also known as the auditory nerve. Your book has it as vestibular cochlear, which is also going to help you when you learn about the ear, because it makes more sense that way, because we have the vestibular branch and the cochlear branch. But you can, for this purposes, you could say vestibular cochlear or ocular or auditory. Both are acceptable. So this mnemonic uses auditory. Then you have glossopharyngeal, vagus. Then you have spinal accessory. So it could be called spinal accessory or accessory. Either one is acceptable. This mnemonic has it as spinal accessory. And then last but not least, hypoglossal. So there's your mnemonic for one I'm giving you for learning their names. Again, I give you that as an example. It's much better to design your own if you can. Actually, that'd be an interesting discussion activity. Maybe I should set that up. I'll see if I create that as a discussion activity, have you guys as a class come up with your own mnemonic. But again, sometimes people like to make their mnemonics a little bit more racy and offensive, so I'll let you do it on your own. I won't make it a discussion assignment. The other one is for function. So I'll go to the next slide. Just to give you a little bit, so you have the cranial nerves could be sensory or special sensory, but either way, we're just going to call them sensory for our purposes, motor, or both sensory and motor. So here's an overview of those cranial nerves. So we have the red referring to sensory, and blue is the motor function. So you can see some, like trigeminal, have both sensory and motor function. Facial nerve, sensory and motor function. But optic, olfactory, vestibular cochlear are sensory only, whereas the spinal accessory is motor only. So a good mnemonic for this is, some say marry money, but my brother says big brains matter more. So that's sensory, motor, both. Motor, both, sensory, both, motor, motor. So that's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So there's your cranial nerves, and their basic, are they sensory, motor, or both? So that's, some say marry money, but my brother says big brains matter more. Hopefully that helps. If not, make your own mnemonic. All right, so now we're leaving the cranial nerves and going to the spinal nerves. There are 31 pairs of spinal nerves. They're named based on where they leave the spinal column. So if they leave between near the cervical region, we call them the cervical nerve. In the thoracic region, thoracic, so on and so forth. So we have 31 pairs of spinal nerves. In addition, many times the nerves, once they leave, they'll actually join with a nearby spinal nerve. So you have the C1 and C2 joining together and forming part of what we call the cervical plexus. Plexus just means braid, so it's a braid of nerves in the cervical region. We call it a cervical plexus. And there's a very important nerve that comes from that plexus called the phrenic nerve. It innervates the diaphragm, allows you to breathe. Without the phrenic nerve, your diaphragm won't contract, you won't be able to breathe. So it's a very important nerve from the cervical plexus. You have 4 major plexes. You have the cervical, brachial, lumbar, and sacral plexus. And each one of those has important nerves that you need to learn that come from them. So here's a picture of the plexi, the 4 plexi of the human body, and many of the nerves that you need to identify are highlighted. We'll really focus on the nerves and identifying the nerves in the lab component. But here's our list of the nerves that you need to identify from each individual plexus. So you have the cervical, brachial, lumbar, and sacral. And the cervical, the only nerve you need to be able to know is the phrenic, and that innervates the diaphragm. The rest of the nerves, you don't even need to know what they do. You just need to know where they come from, which cranial nerve, which plexus they come from. All right, so we talked about the spinal nerves coming out at certain places and then joining the plexus. But one of the things that's really interesting, and it's clinically relevant, is that each nerve, each of the 31 nerves that comes out, has a very particular area of the body that is responsible for receiving sensory information from the external environment. So if, for example, I had an injury specifically to the lateral aspect of my forearm, part of my brain, the part of my peripheral nervous system that's going to send that signal to the brain is the nerve that comes from C5 and C6. And the reason you can use this even more important clinically is, let's say somebody has been injured in a car wreck and you don't have an MRI or CAT scan available to them, and you want to know, where's that injury? Is it really high up on the neck, or is it down low in the back? Is it anterior or is it posterior? Let's say they can't move their arms. If they can't squeeze your hand, has the nerve been severed? Well, if they can't squeeze their hand, there might be something else. There might be too much swelling or some other issue that's preventing the nerve from being able to create the motor control. But if you touch their hand and they can feel it, then you know, oh, the spinal cord's not severed. They can still receive that sensory information. But let's say you can touch the lateral portion and they can feel it, but if you touch the medial portion, they can't feel it. You know exactly where the injury is. It's right between C6 and C8, and we call that C7. So that spinal nerve C7 and everything below it is injured because it's, the way sensory information starts peripherally and works its way up to the brain. So you know exactly, just by knowing these dermatomes and knowing where the paralysis starts or where the lack of sensation is able to be detected, you can figure out where the injury occurs. Also, there's a disease called shingles that specifically affects sensory neurons. And how do you tell shingles versus another, which is just a rash that develops on the skin? How do you tell it from a normal rash? Well, the only way to be able to do that is knowing the dermatomes. So here is an area of the body that corresponds to a specific dermatome. So let's go to the last slide here. So here's the T11 or T12, one of those two, and has that very particular shape. And so we can know that this virus this is a rash, is probably shingles. That's caused by the same virus as chickenpox. So if you got the chickenpox vaccine when you were a child and never got chickenpox, you're probably not going to get shingles. But my generation, there wasn't a vaccine, so most kids got chickenpox, are susceptible for the rest of our lives to getting shingles flare-ups. And so being able to identify that is very important, because the treatment is slightly different than a normal rash, like a contact dermatitis. And so you have to be able to recognize the different dermatomes. And this virus for shingles can remain dormant within the anterior gray horns for years before something triggers the reactivation. All right, so that ends Chapter 13 material. Here are some test questions, test review questions you should be able to answer after watching this video about the peripheral nervous system. You know what to do. Good luck.